Hello, I'm Dr. Ian Strawford. I'm a cosmetic and wellness doctor, and I'm the medical director of Skin Excellence Clinics. Do you suffer with a double chin? Do you really hate that extra bit of skin that's hanging beneath the main chin? Have you lost the jawline, or you've never had the jawline and it just feels like all of that fullness in the neck is just making the face and the neck just become one? Have you been looking about what you can do about that? Are you trying to find out how you can treat the double chin and the fullness in the neck? Well, let me tell you, at Skin Excellence Clinics, we've been treating double chins for many years.
What are the causes of a double chin?
So what causes a double chin? Well, when we say a double chin, we're talking about a fullness or an extra amount of fat that is hanging beneath the chin in the central part of the neck. And that might extend to the whole of the upper neck. So there's no absolute contour or definition between the jawline and the chin itself. And it certainly can be that people are born that way, and that's genetically the shape of their face and neck. But in a lot of us, it happens with age. Often, if we gain weight, then we may gain excess fat and weight in that upper neck and jawline area. It can be associated and made worse by what's called retrognathia of the mandible. That is basically the jawbone can be genetically short, and we know that the jawbone actually shrinks with age, so that retrognathia can get worse with age. So it's a combination often of the excess fat and fullness in the upper neck with the laxity there, getting worse with age, and the jawline contour. And those are usually the main causes.
What treatment is possible?
So treatments for a double chin, historically, the only treatment really has been liposuction to remove the excess fat in the upper neck and chin area. There are, and I have used myself, but I no longer use, injections called fat dissolving injections where it's a chemical that goes injected into the fat to try to dissolve it. But in my experience, both liposuction and chemical dissolving of the fat, and even fat freezing, cryotherapy of the fat to destroy the fat, all have limitations. And those limitations are predominantly that there is no contraction of that excess skin. So although the fat might go, you're left just with a lot of excessive aging skin in the upper neck following those treatments. So the treatment that we have at Skin Excellence Clinics that we've been using for over 8 years now is something called FaceTite, or better term NeckTite, which is an energy treatment to the upper neck. But not only does it cause a destruction and a shrinkage of the fat in that area, we actually do even suck out some of that fat after treatment in the area, just like with liposuction. But through the thermal activity of the FaceTite NeckTite, there is a contraction over the next 6 months of the skin to hold that skin back in and to give that jawline profile and upper neck tightening. That's called FaceTite NeckTite.
Are fillers usually needed to treat a double chin?
Fillers may be needed as well when we're treating the double chin, because if there is jawline shortening or chin regression called retrognathia, then we can further improve the contour of the jawline by placing filler on the bone to push forward the chin. That also tightens the skin in the upper neck. So in a lot of patients, the combination of FaceTite NeckTite with chin augmentation with filler gives a really, really good natural looking result.